right, chapter 20, looking now at the organisms that can cause meningitis. We already mentioned meningitis as an inflammation of the meninges, that layer made up of those 3 layers that cover the brain and the spinal cord. This can lead to an anatomical syndrome where we have different microbes that cause meningitis. They produce similar syndromes, so it all kind of looks the same. But there are some non-infectious causes of meningitis as well, but they are very rare. The serious forms here of the acute meningitis, so the kind of short-lived ones, are mainly caused by bacteria. And the entrance, again, the blood-brain barrier that helps protect against bacteria from getting in. This is usually facilitated or helped by some co-infection or a previous infection, so something that's kind of weakened maybe that, and especially the link between respiratory viruses. So having a respiratory virus and then it kind of lessens that the linkage of the blood-brain barrier and allows those bacteria to get into the brain. So when it's suspected, this is looked for in the cerebral spinal fluid. So they'll obtain the CSF, they'll do the Gram stain on it, and then they start with a broad spectrum antibiotic until they're for sure what it is. So then once diagnosis is confirmed, then they'll shift the treatment to something specific against that agent. But because infection or inflammation of the meninges can be so detrimental, again, using that broad spectrum to get started is the best course of treatment. So some of the signs and symptoms, again, things affecting the brain. So photophobia, so again, sensitive to lights, headache, which can be caused by so many different things, painful or stiff neck, fever, increased white blood cells in the cerebral spinal fluid, and then some of the organisms have additional characteristics that we'll talk about. A little bit more about the meningitis. So this can be acute or chronic, so short-term or long-term, and some are more likely to cause acute meningitis while others are more likely to cause chronic. So we'll mention those as we go through. Typically, though, in a healthy individual, it's difficult for those microorganisms to get in, again, due to all the barriers the brain has. Again, usually those that get in have specific virulence factors, or it's due to that co-infection with some type of respiratory virus or infection. All right, so looking at some of these organisms, so Neisseria meningitis or meningitidis. This is a diplococcus, so we have 2 cells that kind of join together, so cocci, so they're circle. This is also known as meningococcus. Again, some epidemic forms of this exist, and this is mainly going to cause acute meningitis, but this Neisseria meningitis is the main cause of the serious forms of acute meningitis, so those that are most fatal. Again, we have dissemination here. So there's an infection of the Neisseria meningitis in the nose or throat. So it starts with that viral kind of infection. And then after or with that infection, they're then able to better gain access to the brain. Also, this is, if we look at how it's transmitted or the virulence factors, meningococcosemia, so getting that into the blood is rare, but if it does happen, there's a high mortality. This organism is able to produce an endotoxin that stimulates or activates those white blood cells. And so again, here it's not so much the organism, but it's the immune response to the organism that's so damaging. So the cytokines that get activated can damage the blood vessel, leads to vascular collapse. That's what we're seeing here in this poor little baby. Again, hemorrhaging that can occur, those purple lesions, those petechiae that can happen on the trunk or the appendages. All right, then Streptococcus pneumonia, or also pneumococcus, is what this can be referred to. This is the one that causes the majority of bacterial pneumonias. So we see this in community-acquired meningitis. This one, unlike the Neisseria, does not cause the petechiae. And again, mainly those who have some type of underlying susceptibility, so some immunocompromised or co-infection. Right, so our small gram-positive, these organisms, they have kind of a flattened coccyx, so again, circle, but a little more flattened. Again, so it gives that distinct appearance on the gram stain. So with that gram stain from the cerebral spinal fluid, pretty easy to detect. They do produce the capsule, so that's that sugary layer on the outside, and it helps prevent against phagocytosis, so it kind of evades the immune response. As far as other virulence factors, they produce an alpha hemolysin, also hydrogen peroxide, and those both cause damage to the CNS and to the blood vessels that lead to some of the other effects that we see. There are a couple of vaccines that are available against this to help fight this. Another organism here that we talk about with meningitis, Haemophilus influenza. So this is a gram-negative coccobacillus. It's one of the most severe forms of meningitis, so thankfully not the most common, but the most severe. It's often called the Hib because it produces this serotype B to be produced in most of these infections. There's also recently been shown as serotype A that has been seen in the United States and is very aggressive. But vaccination has reduced asymptomatic carriers and therefore helping to virtually eliminate Hib in the United States. Organism here, Listeria monocytogenes. This is gram-positive, also kind of coccobacillus. It does have these long filaments in a palisade kind of formation that we can see. No capsules or endospores. It does have flagella, 1 to 4 of them. It has some, it's not fastidious, so it is resistant to the cold, also to heat, salt, pH extremes, and bile, so it helps it survive against some of our innate immune responses. It grows inside the host cell and then moves directly from infected cells to adjacent healthy cells. So again, that flagella allows it to be motile, so it can move and spread that way. Listeriosis is typically mild or subclinical in most healthy adults. Again, just fever, diarrhea, sore throat, nothing that really stands out that would let somebody know that exactly what they have. However, it does affect the brain and the meninges, leading to septicemia in those who are older or immunocompromised. Also, in the fetus or neonates is where this would be more severe. So this bacteria can cross the placenta, and then lead to a premature abortion or fetal death. And that rate is around about 20%. So this is associated with contaminated dairy, poultry, and especially meat. So again, this is why pregnant individuals are told not to eat, especially processed meat. Listeriosis is very common in those. So again, staying away from those is one way to help in this prevention. Next, we have Cryptococcus neoformans. This is actually a fungus. So our first of the fungus here that causes chronic meningitis. So gradual onset, but then stays around for a long time. Again, mainly seen in immunocompromised. These actually have a fast onset and an acute disease instead of slower and chronic. It is widespread. It's found in many areas. It has kind of this spherical to ovoid shape and a very large capsule. That's what we're seeing here. So again, the sugary layer on the outside, but this capsule is very thick. Again, it helps protect it against phagocytosis. This is mainly transmitted and bird droppings, so exposure to those. Causes coccidioides, or also referred to as valley fever. So again, it has a distinct morphology. So it looks a little different depending on the temperature that it's grown at. So at 25, kind of has this moist white colony that's abundant. But whenever it gets a little warmer, this is the parasitic phase, and it moves more to a spherical. So again, based on temperature, first at 25, kind of this filamentous, we see the hyphae of the fungus. But then whenever the temperature increases, and this would be in the body temperature, or whenever we have a fever, so 37 to 40 degrees Celsius, it's going to have more of this spherical shape. So again, true systematic fungal infection has a high virulence. It's able to evade our immune system. It does seem that there's some genetic susceptibility that gives rise to a more serious disease. So some genetic traits, just if we are infected, causes a more severe disease to occur. Now our viral meningitis, there are about 4 of the 5 meningitis cases that are caused by one of a variety of viruses. So we have aseptic meningitis. This is viral meningitis. Is assumed when a patient shows symptoms of meningitis, but there are no bacteria, no fungus, no protist, then it's assumed to be some type of viral infection, kind of process of elimination. Again, the majority of cases in children are about 90% are caused by an enterovirus. Herpes simplex virus 2 can sometimes cause meningitis. It can also cause encephalitis, so it can infect the brain. HIV can also manifest as meningitis as well. Again, generally milder than a bacterial or a fungal infection. It can be resolved in a couple of weeks, so less mortality with the viral infections. All right, so if we kind of look at our summary tables to go back over these, so the Neisseria meningitis, again, virulence factor, they have that capsule to prevent phagocytosis, but they do also produce endotoxin and an IgA protease, so it can break down those antibodies of the IgA class. Prevention, so there is a vaccine that is available, as well as some treatment as well from different antibiotics. Again, some of the features, those petechiae that occur there, and then the meningococcosemia, also rapid decline. So once this starts, the symptoms are very drastic. Then our Streptococcus pneumonia. Again, this is due to exposure to droplets. Again, as far as virulence, they have the capsule as well. It can cause or induce apoptosis, which is going to kill cells that has that hemolysin, as well as hydrogen peroxide that can be damaging to the cells of the brain. Again, there are vaccinations that are available against both of these. Again, this is considered a serious threat by the CDC. There are some treatments as far as antibiotics that are available here, but they do cause, again, a serious acute cause in adults. So typically in adults, this is the main cause of meningitis. So the Haemophilus influenza, again, also from droplet contact is how this is spread. As with the others, they also produce that capsule that occurs there. So there is vaccine that has greatly decreased the prevalence in the United States, but can also be treated and prevented with antibiotics. As far as the distinctive, again, this is also a serious acute, but it is less common now that we have the vaccine available. Our listeria here, again, mainly transmitted by food, so not fully cooked food. Also, the unpasteurized dairy products can contain it. Again, processed meat, so pregnant women staying away from those as well. This can be treated by antibiotics, typically asymptomatic in healthy adults. However, again, in the neonates, elderly, and immunocompromised, this can be a very serious and fatal infection. So avoiding and preventing is most important. The cryptococcus, so again, the fungal infection here, mainly transmitted by the air and dust. They do produce kind of this capsule layer around it, treated by anti-fungal agents. This can be acute or chronic, and it's most commonly seen in AIDS patients. One of the most, besides having HIV, one of the most common infections that they get. Right, we also have the coccidioides, also transmitted by the air, like with our fungal infection. These can cause granulomas, those kind of spherical formations that we get at different temperatures. Again, avoiding endospores that are transmitted by the air. There is some treatment that are available, but it's most exclusively in endemic regions that this occurs. And then there are multiple viruses that can cause meningitis, just kind of collectively grouped here as viruses, typically by droplet contact. These can cause lytic infections, so that causes lysis. So remember, viruses go in, and lytic means that they cause lysis. That's how they get out, which damages the cells. So typically, there's no treatment unless there is a specific virus that can be identified. Again, it's just kind of collectively, it's referred to as viral meningitis when everything else has been rolled out. Thankfully, typically the viral meningitis is milder than bacterial or fungal. So about 4 out of 5 meningitis cases are actually caused by viruses. So again, typically most are going to be more mild due to the viral infection, but of course the bacterial are more severe. All right, looking just a little bit more at some of this neonatal and infant meningitis. So this is usually the result of an infection transmitted by the mother, so in utero, so during pregnancy or during passage through the birth canal. So as more premature babies survive, this rate is increasing. Also, morbidity has increased. Mortality, though, has declined. So it's becoming more prevalent but less fatal. So the two main causes are Streptococcus agalacti and then E. coli. Also, the Listeria that we'd already mentioned is also found in the neonates, as we've already discussed. So looking at the other two here, so Streptococcus agalacti. So this is a group B Streptococcus. It's about 10 to 30% typically found in the female genital tract. Again, this is the most frequent of the neonatal meningitis. So during birth is whenever they would be exposed to this. It can be treated with penicillin, sometimes supplemented with another antibiotic and aminoglycoside. Right, E. coli is the second most common cause of the neonatal meningitis, typically due to a premature birth. Mortality is about 20%. Those that do survive, though, often experience some type of brain damage, and again, typically transmitted through the birth canal during delivery. Right, then we also have Chronobacter sakazakii. This is found mainly in the environment where they can survive very dry conditions. This is implicated in outbreaks of neonatal and infant meningitis. This is mainly going to be found in powdered formula, so it would be contaminated in it. Thankfully, these cases are rare, but whenever they do occur, again, the mortality is very high. The Chronobacter used to be Enterobacter, so there was a former name, but again, this is mainly found in contaminated formula. So our summary table here, so again, most common form is streptococcus, vertical transmission from the mom. As far as virulence, we have that capsule to prevent phagocytosis. So preventing, knowing that the mom would have it so it could be prevented, and then treating with antibiotics. Then with E. coli, second most common, again, vertical transmission from the mom, and then treating with those antibiotics. Listeria, we already mentioned before, but again, vertical transmission, the Chronobacter. This is typically found, unlike the others, not by vertical, but through the vehicle by the baby formula that would be contaminated. Right. Then we also have a group here called meningoencephalitis. This is kind of a combination of the brain and the meninges being infected. So again, encephalitis is inflammation of the brain, meninges, inflammation of the meninges. So whenever you have both of these, we get meningoencephalitis. So this is due to that close association, of course, between the brain and the spinal cord and the meninges. Mainly these are going to be caused by amoeba that cause these. All right, so looking at these two types of amoeba, so we have the Naegleria, small flask kind of shaped amoeba that move by pseudopods. They can form a thick-walled cyst that helps them resist high temperatures and some chlorination. These are reported typically in those that have been swimming in warm bodies of fresh water. So is how, because all the amoebas here have to exist in water. So they're forced into the nasal passage to utilize that olfactory nerve and use that to enter into the brain. A little bit more about them, they enter into that subarachnoid space, causing what's referred to as PAM, or primary amoebic meningoencephalitis. Causes rapid, massive destruction of the brain, so very high mortality. Thankfully, it is rare, but again, treatment is futile because it moves so quickly. Just looking at some numbers, again, rare, there's only about 29 people that were infected here, but due to contaminated waters caused by slip and slides and kind of non-sterile water here, using neti pots as well. So then our acanthamoeba, these are large amoeboid trophozoites that can form. Again, they can also form that cyst to make them resistant. It invades through the broken skin, conjunctivitis, so in the eye, can get through the lungs or the neurogenital, and then it causes GAM, which is granulomatous amoebic meningoencephalitis. Just rolls right off the tongue. It is a little bit lengthier, so again, PAM is very quick, and survival rate though is not good. So with these amoeba, they have very high morbidity. And then just wrapping up here with our summary figures. So again, the PAM transmitted through the contaminated water, even the slip and slide or the neti pots. It's very invasive. So again, very kind of no reason to treat it. There are some treatments, but because it's so fast, typically those are not effective. And then the GAM, again, direct contact here, also very invasive. Again, can try to remove those granulomas, but again, typically kind of a futile response.